Gabriel, my name is Anne Marie, and today I'm going to be doing your head-to-toe assessment that requires us to do several different exams, several different tests, and it requires me to touch you. Is that okay? All right, I'm going to begin with your skin. So go ahead and put your hands out for me, your feet out. All right, so your skin is a light brown color. It's warm to touch. It's smooth with the upper extremities and the lower extremities. There's hair noted on the upper extremities and lower extremities. That's consistent with male pattern hair distribution. It's black, it's coarse. Yeah. Over here, let me see your hands. All right. So I'm going to check your nails. Okay, so your nails on the upper and lower, your nails have a brisk cap refill, which is less than 3 seconds. They all adhere to the nail bed. Go ahead and do this where you kind of make like a heart, and then do each finger, your pinky, and then now your thumbs. All right, so there's no evidence of clubbing. Nail bed is at 160 degrees. I also want to note that your skin is without any varicosities or edema. No edema noted. All right, I'm going to go ahead and start with your head now. So your head is erect. It is normal cephalic. It is symmetric. I'm going to go ahead and touch your scalp, okay? So your scalp is freely movable without any masses or bulges or lesions noted. I do see a macule on the left lateral side of your head there. All right. I'm going to go ahead and start with your face. Okay. So your face, we're going to start with your eyes with your face. Your eyes, beginning with your eyebrows and your eyelashes, you have no hair on your head, but we can tell, did you just shave your head?
Yes.
Okay. So I'm going to go ahead and start with your eyebrows and your eyelashes. Your eyebrows are thick, they are coarse, they are black. They approximate in the center and they go to the outer canthus of your eyes. Your eyelashes are upward and outward bending. They are full. I'm going to go ahead and bring your face down, okay? All right, your conjunctiva is pink and your sclera is white. I'm going to go ahead. All right, Gabriel, I'm going to go ahead. I'm going to have you look behind me. Look at the wall behind me. All right, and we would do this with the lights off. Just going to check. And continue to look behind me, and then focus your eyes, fix your gaze on my pen. Go ahead and focus. Okay, so your pupils are equal, round, they react to light and accommodation. I'm going to go ahead now and test cranial nerve number 2, which is optic. We're going to go ahead and do a couple of different things. For optic vision also we do the Snellen test, which is for distant vision, and the Rosenbaum test, which is for near vision, and that's when you hold the card 14 inches in front of you and you would read everything. That would be for near vision, and the Snellen test is the chart that you stand 20 feet, cover your eye, you read from top to bottom, and then the numerator 20, it's 20 over whatever it is, so 20 is the distance that you're standing, and then say your distance is 20 to 30, so you see at 30 feet what a normal vision 20/20 they would see at 20 feet. So that's the Snellen-Rosenbaum test for cranial nerve number 2, and also optic. But what I'm going to do really quick, and we're going to go ahead and I'm going to look into your eye for cranial nerve number 2. Alright, so we would do this with the lights off, but I'm going to go ahead and stand here. And I need you just to go ahead and look straight for me, please. Okay. So I note the red reflex, and I'm going to come in closely, Gabriel. Okay, note the red reflex. The optic disc, the retinal background, and the fundus are all noted. The fundus is a creamy yellow color, full of arterioles and venules at a ratio of 3 to 5 or 2 to 3. If you follow... If you follow the fundus nasally, you can come look at me now. If you follow the fundus nasally, you'll come to the optic disc, which is like a frisbee shape. And then if you go 1.5 millimeters, it's about 1.5 millimeters in diameter. If you follow that 2 discs millimeters over temporally, you'll come to the macula densa. It's avascular, and actually that's where the center of vision is, the fovea centralis. And we would do this bilaterally. All right. Also, with your eyes, I'm going to go ahead and assess for cranial nerve number 2 also is confrontation. So I need you to, this is the bunny. So when you see the bunny, say now, okay? So go ahead and cover your right eye. I'm going to cover my right eye. And when you see the bunny, say now, okay?
No. No.
Okay, now keep that eye closed.
No. No.
And one more.
No.
Okay. You can relax your hand, sorry. Alright, so that'd be cranial nerve number 2. Optic. So now we're going to go ahead and do cranial nerve number 3, 4, and 6, which is ocular motor, trochlear, and abducens. And that would have to do... Alright, so we're going to go ahead and do the 6 cardinal gaiters. I need you to move just your eyes only, okay? So look at my pen and just move your eyes only, okay? Okay. Alright, now I'm going to go ahead and put my light a little further. I just want to see if we have a twinkle in your eye. The corneal light reflex, perfect. It's in both eyes. If it was not, we were going to go ahead and do the cover and uncover test. That's when you would go ahead and cover your eye, Gabriel, your right eye. Go ahead and cover it. All right, and just look again behind me. Now I want you to shift your gaze over to the left. Keep looking that way. Now remove this hand. Keep looking. Remove that hand, and both your eyes went over to. Both your eyes moved over that way. There was no sign of nystagmus or anything like that. Your eyes, can you close your eyes? I'm going to go ahead and touch the lacrimal ducts, the lacrimal sacs. Okay. And is there any tenderness there?
Mm-mm.
In the sinuses as well? So no sinuses, no tenderness in the sinuses area. Go ahead and open your eyes. Also with that, I have to mention that the lacrimal ducts and the lacrimal sacs, they didn't have any tenderness noted. With your head also, I'm going to go ahead and assess for lymph nodes. So I need to go ahead and do your lymph nodes. So this would be preauricular, postauricular, occipital, retropharyngeal, submandibular, sublingual, and submental. And no lymph nodes were noted there. If they were palpable, they're not palpable. We have also the anterior cervical chain, the deep cervical chain, and supraclavicular. And there are no lymph nodes noted, which is good. It's not enlarged. We're going to go now move down to your nose. All right. Let me see. One little light here. Your nose sits on your face. It's symmetric. It's also a light brown color. And I notice that there's a papule on the right side of your nose. I'm going to go ahead and look into your nose, okay? With the light. All right, thank you. Okay. Your nares are symmetric. Your nares are symmetric. The septum is symmetric without any deviation. There are no foreign bodies noted. The inferior turbinates are visible, but the superior turbinates are not visible. With cranial nerve number 1, which is olfactory, we're going to go ahead and test that. Can you occlude one of your nose and breathe in? And I'll do the other one. Occlude in. Very good. Okay, so I'm going to have you close your eyes, and I need you to smell. Close one of your nostrils, I'm sorry. Close one. All right, now I need you to smell this, and you tell me what you smell, okay? Are you ready? All right, go ahead. What does it smell like? What is it?
Almond.
Okay. All right, you can open your eyes. Actually, I'm sorry. Go ahead and occlude the other nostril. Close the other nostril. And I need you to go ahead and smell, okay? Inhale. What do you smell?
Cinnamon.
Okay. That's cranial nerve number 1, olfactory. Which is very good. I'm going to go back up here to your mastoid process, which is cranial nerve number 5, trigeminal. So I'm going to have you, touch your jaw here. Open and close your mouth. Close. Open again. Move your jaw side to side. All right. There's no crepitus noted. All right, I'm going to go ahead and open your jaw. Try to open your jaw. Don't let me do that, okay? Keep it closed. Jaws clenched. Very good. There is no crepitus noted. Jaws freely movable. Let me go ahead and check. Sensory. So you tell me if it's soft or sharp, okay?
Sharp. Soft. Sharp. Soft.
Very good. That's cranial nerve number 5. All right, so with the face here, we're going to move on to the mouth, but before we do that, we're going to go ahead and, since we did cranial nerve number 5, trigeminal, we're going to go ahead and move on to cranial nerve number 7, which is facial. And this is what they call facial gymnastics. So I need you to smile for me. All right, now smile without your teeth. Frown, purse your lips out, puff your cheeks, and tongue in the cheek. Very good. Now go ahead and close your eyes and raise your eyebrows. Now go ahead and go. I'm going to do it against my resistance. So go ahead and don't let me open your eyes. Very good. All right, and that's cranial nerve number 7. I'm going to go now move along to your mouth now. Your lips are distinct. They are moist and they are pink. Let me see. We're going to go ahead and I need you. There's no sign of any kind of deviation with the mouth or anything like that. All right, open your mouth for me, please. Stick your tongue out. Say ah. Very good. I need you to move your tongue from side to side. Very good. And say ah one more time. All right, let me go ahead and get my point. I'm sorry. Stick your tongue out. I'm sorry. Say ah one more time. Say ah. Okay, very good. So the tonsils are at a +1. The buccal mucosa is pink. It is moist. It is without ulcerations. Stick your tongue out. The tongue is well papillid. The posterior pharynx, open under your tongue. Let me look under your tongue. And the sublingual is well vasculated. Sublingual frenulum is noted along with, let me see. I'm going to move your lip, okay? Just a little bit. Sorry. The inferior and the superior is not their frenulum, but the inferior and the sublingual frenulum is intact. Open your mouth one more time. I'm going to count your teeth. Count your teeth. Okay, ready? This is just a Q-tip. Okay, so you have 28 teeth, and let me see, and 2, looks like fillings, and no sign of any other dental caries. All right, so with the rise and fall of the uvula, the soft palate, open your mouth really tight. I'm gonna feel the top of your mouth. Okay, so the top is, the palate, the top of the palate here and the front is rugged and it goes to soft. With the rise and fall of your uvula, swallow, speech, and gag, that all and has to do with cranial nerve number 9 and 10, which is glossopharyngeal and vagus. Your tongue going back and forth, that's cranial nerve number 12, hypoglossal. All right. So what we're going to do now is we're going to go ahead and move along down to the neck. Okay, so your neck is symmetric. I have to move your shirt a little bit. All right, so your neck is symmetric. I notice there's a macula here on the right lateral side. There's no sign of any kind of lesions or anything like that. We've already tested for the lymph nodes with your cervical chains, and there was no nodes that were noted. What I'm going to do is I'm going to go ahead and we're going to do the range of motion for your neck, okay? So I need you to just do, so you're going to go ahead and do flexion, extension. Right now let's do lateral rotation side to side and do lateral bending. Okay, very good. I'm going to go ahead and have you shrug your shoulders for me. Okay, and now put your side, I'm going to push you to the door, but don't let me. Now I'm going to push you this way, but don't let me. Very good. That'll be cranial nerve number 11, which is spinal. All right, so what we're going to do now is we're going to go ahead and move along to your thorax. Okay, go ahead and take off your shirt. Okay. All right, Gabriel. I'm going to start with inspection. All right. So your thorax is same. Your skin color is a light tan color. I notice there's a left macule on the right, a macule on the right side of your chest area here. You have hair on your chest, which is consistent with normal male pattern hair distribution. It is a light gray, silver with black color. I'm going to go ahead and touch your chest here for any bulges or masses. Anything like that? All right. Can you face the closet, please? I'm going to feel the back of you as well. Same thing for any bulges or masses. Okay. None noted. I'm going to go ahead now, Gabriel, and do thoracic expansion. So would you be able to breathe in for me, please? Breathe out. Okay, and the 10th rib, intercostal rib here, it was symmetric as you breathe in and out, which is very good. All right, Gabriel, I'm going to go ahead now and have you say the word 99 when you feel my hands on your back here, okay?
99, 99, 99.
Okay, and tactile firmness was heard on the ulnar aspects of my hands. All right, there. I'm going to go ahead and auscultate your lung area, okay? All right, so just breathe in and out normally, okay? All right, Gabriel. Now I'm going to go ahead and listen to your anterior side. Okay. Just breathe normally, okay? Okay, very good. Okay, Gabriel. What I'm going to do now is I'm going to go ahead and measure your diaphragm. So I'm going to have you, no, stay as you are, stay as you are. All right, go ahead and cross your arms. So what I would like you to do is I want you to go ahead and you're going to cross your arms like this, all right? You're going to breathe in and hold it, but not yet, okay? You're going to breathe in and hold it, all right? You ready? All right. So go ahead and breathe in, hold it. Okay, relax, breathe. All right, so now I'm going to have you go ahead and breathe in, and then you can bend over just a little bit. So you're going to breathe in, and then blow your air out, but keep blowing it out, okay? You ready? Breathe in, and breathe out. All right, relax. There it is. I'm going to go ahead and measure that. It is exactly at 6. So a little bit back. The norm is between 3 to 5 centimeters. Okay, Gabriel, I'm going to go ahead and listen to your heart now. Go ahead and lie on the bed, please. Gabriel, can you sit up for 1 second? I'm sorry. I have to do one more thing I forgot to do, and then we're going to go back to your heart, okay? It has to do with your hearing. When I checked your hearing, I forgot to do the Weber test and the Rhine test. All right. My hair is falling out. 1 second. Working before. I'm sorry. Go back here. All right, so we're going to go ahead and do the Weber test. You tell me if you hear this in the right ear, the left ear, or both, okay?
Both.
Very good. All right, and this would be the Rhine test, okay? And this Weber test, the Rhine test, and we're going to do a whisper test, has to do with cranial nerve number 8 acoustic. So I'm going to go ahead and do it one more time. I'm going to put it on back here. You tell me. Tell me when it stops.
Stop.
Now, tell me when it stops.
Stop.
Okay. So this here is the Rhine test. And it means that your air conduction was greater than bow conduction by 2 to 1. I wanted to go back to do that. Also, we're going to just do one more test with the hearing, which is the whisper test. So go ahead and close that ear. I'm going to go behind you and whisper. You just tell me what I'm saying, okay? Bananas, peaches, apples. What did I say? What did I say?
The air smells like sweet apples.
Okay. All right. I didn't say that, but that's okay. You came pretty close. Bananas, peaches, apples. We'll try next time. All right. So, I know. That's okay. All right. So, also, I want to note when we were doing your lung area, that your area here is a 2 to 1 ratio transverse. Your lung area here. All right, so now we're going to go back to the heart. If you can please lie down. Do you need a pillow? All right. I'm going to go ahead and listen to your heart, okay? I'm going to begin with, go ahead and close this. I'm going to go ahead and begin with, okay, so second intercostal space, right sternal border, which is aortic. We're going to listen with the bell and the bruit. The bell, not the bell and the bruit. We're listening with the diaphragm and the bell. Okay, now third intercostal space with the diaphragm. This is the pulmonic. We have aortic, pulmonic, Erb's point. This is aortic is the second, right intercostal border. Then we have pulmonic is the second intercostal border on the left side. Then Erb's point is the third. This is, excuse me for a second. With the diaphragm and the bell. Okay, now 3, 4 would be tricuspid. And then the mitral, which is the fifth intercostal space. Midclavicular line, which is also known as the apical pulse and point of mass index. I would also be noting that the chest area, you can palpate the point of mass index. And the PMI, the point of mass index, is freely palpable. There are no heaves or lifts or thrills on your chest here. You can sit up for 1 second. Okay. S1 and S2 were noted. S1 and S2 aortic or ventricular, and S2 would be aortic over pulmonic. There's no S3 or S4 sounds noted. Okay, with that, I'm going to go ahead and listen to your pulses, okay? So I'm going to go ahead and palpate your, I'm going to not palpate, I'm going to listen to I'm going to, with the diaphragm and the bell for bruits. All right, if you want, actually you can lie back down. I'm sorry, I'm giving you a workout. So we're going to go ahead and your carotid. Okay, and then we would do the brachial pulses. The radial pulses, facing bilaterally. Okay, popliteal. Can you move up in the back? I gotta do your, yeah, just over. Popliteal, which is your knees, and bend them up a little bit. Okay, and then you would have dorsalis pedis and posterior tibia. All right, go ahead and sit up for me, Gabriel. All right. All right. One thing I did not note that I'm going to have you sit. Go ahead and sit to the facing the door, please. When we did your neck, I want to also look at your trachea. Also, go ahead and swallow for me. Do it again. All right, and the trachea goes up and down. There's. I'm going to have you bend your head and turn your head just that way. There you go. So I'm pushing this way. Okay, and there's no nodules noted. Now go ahead and put your head this way. Okay, and there are no nodules noted for the trachea. Okay. All right, Gabriel. You can face this way. So. Okay. what we're going to do now is I'm going to go ahead and listen to your abdomen. We're going to inspect your abdomen. Okay, so go ahead and lie down. You okay? Do you want to move back? Just so you're comfortable. You're more comfortable like that? All right. So, your abdomen is round. It is positive for pulsations and respirations and varicosities noted. You have a scar on the left lower quadrant of your stomach there. I'm going to go ahead and auscultate. Beginning of the right lower quadrant. Okay, and abdominal sounds were heard. We have active bowel sounds in all 4 quadrants at a rate of 5 to 35. Since I'm here, I'm also going to go ahead and auscultate your arteries, your renal, iliac, and we're going to defer the femoral. You have your, do this with the bell. Renal, and now this is the iliac, and we're going to defer the femoral arteries. Alright, Gabriel, I'm going to go ahead now and percuss your stomach, okay? In all 4 quadrants. Alright, tympany is noted. I'm going to go ahead and palpate now, okay? Tell me if you have any tenderness. No?
No.
Okay. There are no bulges or masses noted. I'm also going to go ahead and percuss your liver and measure your liver as well, okay? So it should go from tympany to dullness. Alright, now I'm going to go from resonance to dullness. I'm going to measure that. Let me tape measure. Alright, and it is at 5.5, which is within normal limits. Alright, I'm going to go ahead now and palpate. I'm going to go ahead now and palpate your liver, Gabriel. Okay? So what I want you to do is I want you to breathe in and then I want you to cough for me, okay? So breathe in. And cough. Okay. And the liver is palpable right here, and there's no nodularities noted. I'm going to go ahead now and palpate your kidneys, retroperitoneal. So just keep your body comfortable in my hand, okay? Okay, breathe in. Now. Okay. And your kidney is freely palpable. We would do this bilaterally. I'm going to go ahead and percuss your spleen, okay? Alright, so we have dullness along the costrovertebral margin. I'm going to go ahead and so we have dullness mixed with resonance which indicates to me that your spleen is tucked up underneath where it should be, so it will not be palpable, okay? Unless it was enlarged. All right, you can go ahead and sit up. Actually, can you go back a little bit more? All right, so what we're going to do since you're lying down, Gabriel, I'm going to go ahead and do flexion extension with your hips. All right, so what I need you to do is go ahead and lift your leg up, all the way up straight to 90 degrees. All right, that's flexion, that's extension. Go ahead and bring it out towards me. That's abduction and over. It's adduction. And I need you to sit like a man, which would be, no, oh no, leave that one straight. Okay, that's the external rotation, and then we're going to put knee to knee. No, just leave this one straight. Knee to knee. That'd be internal rotation. Okay, relax your foot there. I need you to go ahead and put your feet down to the ground. All right, that is dorsiflexion. Put it up. I mean plantar flexion. That's plantar flexion. Excuse me. That's plantar flexion. And up to the sky to your nose. That's dorsiflexion. All right, now go against my resistance. So go down with plantar flexion and up with dorsiflexion. There you go. All right, now try to come up again and go against my resistance. So go up with your leg, up, and bring it down. Bring it down. Very good. Now we're going to do eversion and inversion. So I need you to put your feet, bring them across to the other. Oh no, I'm sorry, I said that wrong. Turn them towards your other foot. So that's, leave this one straight. So that's inversion, and now put this foot out towards the closet. That's eversion. Very good. All right, Gabriel. Now, whatever, we would do this bilaterally. Go ahead and sit up, Gabriel. All right. So what we're going to go ahead now is we're going to go ahead. You go ahead and get your shirt. There you go. All right, what we're going to work on now, Gabriel, is some motions. You did your flexion and extension. Now we're going to do hyperextension, so you need to stand up really quick. Just stand up. Now put your one leg behind you. We're going to hyperextend the hip, and that's how we would hyperextend our hip. All right, so now go in front of me. Just, I need you to face me. So we're going to begin with our shoulders. I don't know if you can come and see. All right, so we're going to begin with our shoulders. All right, so we're going to do, ready? So we're going to act like we are going diving. So we're going to do flexion, extension, and then like if we're going skiing, hyperextension. Very good. All right, what we're going to do now is we're going to go ahead and do abduction, adduction. We're adding. Okay, now we're going to go ahead and do eversion, all right, and inversion, like our hands are going into handcuffs. All right, so now with our elbows, whoa, all right, with our elbows, I need you to go ahead, hold your elbows like this. All right, bring them down. That's flexion, extension, and we're not going to hyperextend the elbows, okay? But we can go against my resistance, so go like this. All right, and now don't let me push you. Very good. What I need you to do now is we did the shoulders, and we did that. So now we're going to go down to the wrist. Okay, so go ahead and stick your hands out for me. All right, so just do what I'm going to do. So we're doing the whole wrist area. Okay, so we're going to do flexion, extension, hyperextension. Now we're going to do radial and ulnar deviation. All right, and there's no hyperextension for that. Now we're going to do just the fingers. So the fingers, we're going to do just the finger part. So flexion, like down, flexion, extension, hyperextension. Now we're going to do abduction, adduction, and now I'm going to go against my resistance. Try to open your hand. Very good. Okay. Now I'm going to go ahead and do flexion extension on your hands, but testing your strength. Don't let me bring them up. Okay, so go down flexion. Now extension, bring them up, very good. All right, go against my resistance, that's good. Now, I need you to go forward, you're gonna go against my resistance, so come forward and don't let me push you. Now go backwards, very good. All right, Gabriel. We're gonna move on now to we're gonna do your cerebral function. So I need you to step a couple, like 2 feet back, just take 2 steps back, I meant. All right, so you're gonna do heel to toe. We're gonna see your gait. Yeah, you don't have to go far, just a couple steps. So heel to toe. Whoa. All right, that's good. That's good right here. Okay, now I need you to put your heel down your shin. Down. All right. Now, as fast as you can, we're going to do supination and pronation. As fast as you can. Copy what I very good. Now, we're going to do the abduction. All right, now I need you to put your finger to, with your eyes open, finger to nose. Back out. Finger to nose. Back out. Now do that with your eyes closed. Very good. Okay, now go ahead and have your eyes closed. You can put your hands down now. Feet apart, yeah, just a little bit. I'm going to push you. Okay, this is the Romberg test. I'm going to push you gently. Okay, so that's a negative Romberg. Okay, you can open your eyes, Gabe. All right, so that's a negative Romberg test, which is very good. Okay. All right, Gabriel, so what we're going to do now is I need you to go ahead, we're going to do opposition. So I need you to go ahead and, for your pinky and your thumb, all right? So do everything I'm doing here, so, and then your thumb. Very good. All right, Gabriel, you can have a seat. All right, just a couple more things. We're going to do stereognosis. I'm going to put something in your hand and you have to guess what it is, okay? Ready? Close your eyes. Now feel what it is. Just with the one hand. What is it?
A nickel.
Okay, close. It's a dime. Alright. Now I'm going to write a number for graphesthesia. I'm going to go ahead and write a number in your hand. You tell me what that number is, okay?
5.
Stay.
3.
Okay. It's a 3. Good job. All right. So now I'm going to go ahead and test your reflexes. Okay. You can have your eyes open. You okay?
Mm-hmm.
All right. Be loosey-goosey for me with your arms. Loosey-loosey. You ready?
Mm-hmm.
I don't know if you want to come around this way so you can see it. Right. Totally loose. Okay? You ready?
Mm-hmm.
Close your eyes. No? Okay, good. Sorry, Anna. Relax your hand. Relax, relax, relax. Are you relaxed?
Mm-hmm.
I feel like you're still up.
Mm-mm.
Like dead weight on me.
Mm-hmm.
There, like that. Okay? Good. Alright. Alright, well, you can open your eyes now. Alright, so now I need you to go ahead and say, did your brachial? Did your brachial? Relax.
Mm-hmm.
Good. Yay. Alright, now I need you to go ahead and put your feet to look the other way and pull, 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 pull. Pull, 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 pull. Keep pulling, 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 pulling. One more time. Okay, so you're a +1. Okay, good. So now, lastly, we would do your Achilles tendon, and I'm only going to do the left.
Mm-hmm.
I'm not going to do the right because I know you just had this surgery, okay? So go and put your, you have to put your, put your knees on the bed, but have your feet hanging off. I'm just going to do the left. Well, yeah, you probably can just put the one on the, That's why. Well, no. Can you put your both knees on each other? Both knees? Yeah, there you go. Okay, just have them hanging off. Okay, just relax. Are you able to stand up a little bit? Or like sit on your knees now? No. Oh, good. Okay. Good. And I'm going to defer the right one. You can sit there. I'm going to defer the right one because I know you had surgery on that one. Okay, Gabriel. I appreciate you being my patient today and always. Thank you.
Thank you.
Have a good day.
Thank you.